Jess.
So this is the spinal rocking. So first of all, this is just middle range of spinal rocking. This really gets all the lumbars pretty well evenly. But then if you bring your knees further into your chest, you get lower down, I should say, the lumbar spine. So you're getting more L4, 5, S1 opening there. And then if you let the knees go out a little bit, Greg, that's back to more of the middle range. But then if you bring the knees right down to pretty well vertical, that's really getting your sacroiliac joints. And then you tip from left to right, because everybody has one side of their pelvis much more rigid than the other. And this is a lovely way to mobilise them. It sort of enjoys the pressure on the surface, even if you obviously don't have a treatment couch at home, but you can do this. You cannot overdo this exercise. You can do it ad nauseum. It's the way to get rid of pain if you ever hurt your back. Good, and now we'll go straight into spinal rolling, which again is a great way of getting rid of muscle spasm. And this is really the whole of the spine, and it's like running your forearm down a keyboard. Now he bunches his knees into his chest more. He's going to get his high lumbars more at waist level. Just a little bit less tempo there, Greg. And now taking the legs down so they're lower, so they're a lever that helps him get lower down the spine. And that's really where most people need it, or you can obviously need it in both places, but that's harder to do, and he's using his legs as a lever to help tip his weight down because he's got a very big upper chest. Good, and now what's much harder to do for everybody, including Greg, is to tip left to right on the sacrum. So tipping left to right on the sacrum, and it's easy to nearly fall off the bed. There you go, and that's really wonderful at breaking up the spasm, whereas the knees rocking is good for breaking up the spasm in a different way because it stretches the muscles. Now as he gets better at this, he'll just pivot. He'll stay down the bottom end there, and he'll just pivot left to right from dimple to dimple. That's getting more like it. But the knees will go a bit lower, so he's down more on the dimples. That's it. Extremely hard to do, and he'll find, I'm sure, that most of the strain is at the front of the neck. It's very hard work. There we go.